Hey guys, welcome back to another rapid update. In this video we're going to be talking about prices and affordability of cancer medicines in Europe and a group of Latin American countries based on a recently published study. Stick around. So this recent paper appeared in the Applied Health Economics and Health Policy Journal just a couple of days ago, and it spoke about a comparison of prices and affordability of cancer medicines in 16 European countries and a group of Latin American countries. And the purpose of this video is to reflect on the work that was done, and also to comment on some of the elements of the final study and the results that were provided. So the article starts with highlighting a couple of concerns about the high prices of cancer medicines that may limit patient access. And that this is particularly important in low-income countries, and that this survey focuses on prices of originator cancer drugs in Europe and Latin America to assess their affordability. And the authors here in this paper define affordability from a very specific perspective, and I'll return to this point in just a few moments. So 19 cancer medicines were included in the sample of medicines that they looked at. We'll look at those in just a few moments. And the 5 Latin American countries were Brazil, Chile, Colombia, Mexico, and Peru, and 11 European countries from Austria all the way to the United Kingdom. Price data was extracted. They were adjusted to PPP, purchasing power parity. They utilized a defined daily dose of medicine required, of a dose required for these group of medicines over here across the group of countries, and then utilized a measure of affordability to compare and adjust those prices across the group of countries that they included in this analysis. And the results were as follows. So prices of cancer medicines varied considerably between countries. In European countries with higher levels of income, PPP adjusted prices tended to be lower compared to European countries of lower income and Latin American countries. And we'll look at the graphs presented in the paper, except for one medicine. In European countries of lower income and Latin American and LATAM countries, more than 15 days worth of minimum wages, and this is the measure of affordability that we'll discuss, would be required by a worker to purchase one defined daily dose of several of the studied medicines. And they concluded that high prices and large unaffordability of cancer medicines is a critical issue, and then we need to focus on it going forward. So having said that, I strongly suggest that you download a copy of the paper. It is publicly available. It's here's the download PDF link. The authors have done a great work here in summarizing the materials, the group of countries that were included, and they were as follows. So it ranged, and I already mentioned them, so Australia, Brazil, Chile, all the way to the United Kingdom. They all have very different classifications, World Bank classifications based on income. So here it is LHIC, low high income country. In UMIC, so this is upper middle income countries, and then upper high income countries are also listed over here. It's interesting to note though that none of these countries included are the low income countries mentioned by the author in the opening statement, that it's a particular concern in low income countries, and I think this returns to the point related to the relevance of the measure of affordability utilized in these specific group of countries vis-a-vis its potential and relevant use within lower income group of countries. Again, a point that I'll return to a little bit later on. And these were the group of drugs that were included in the analysis: cetuximab, dasatinib, imatinib was there, mercaptopurine, nilotinib, rituximab, trastuzumab, some of the major players in the cancer space with drugs that have multiple indications. and the defined daily doses were these listed over here. So the authors collected data across these group of countries, summarized them into very useful tables that focused on, first is the prices of the originator cancer medicines in the 11 countries, and then Latin American, and this is what it looked like. So at the towards the left hand side, Colombia, Peru, Brazil, Mexico, and the rest of the countries here, so Latin American countries up until there, Chile, and then from here, this is the upper middle income countries, so Romania, Poland, Hungary, Greece, Spain are here, and then these are the French, UK, up to Sweden, Netherlands. And if you so what's on the y-axis here is the US dollar purchase power parity adjusted price per defined daily dose. When you download a copy of the paper, look into specifically how that was defined and how those adjustments were utilized. But what is glaringly obvious here is that there's a group of countries, these specifically where the price bandwidth is quite narrow, whereas that bandwidth increases, or the variability of the medicine prices increase quite considerably in these group of countries over here. So what's interesting to note, though, that in some cases there is price parity or price consistency across markets. So mercaptopurine, for example, in Brazil, across all countries, in fact, there's fairly consistent pricing. In fact, in Brazil, compared to Sweden and many of these countries, the price is lower. There is quite a lot of variability in cetuximab, for instance, in Brazil, which is the highest compared to many other countries in Latin America. This may be an outlier, so we need to definitely look into that. Likewise, in this instance over here, and this instance over here, these may be outliers. So these are our prices. What we also need to look at then is how this is adjusted based on the following affordability index. And what is being utilized here is a measure of real minimum wages, which is taking the number of days that a worker needs to work in earned wages to be able to pay for a single defined daily dose. And this is the measure of affordability, number of daily minimum wages necessary to buy one daily dose. So in other words, how to interpret this is in Brazil, for instance, cetuximab, a worker would need to work approximately 36 to about 37 days, basically the entire month, in order to afford one single daily dose of cetuximab. Whereas for mercaptopurine, it would be approximately maybe 1 day or half a day. And there is a variability across either board. This is defined and determined predominantly by how daily minimum wage is quantified, and the data the data source is available in the paper. OECD data was utilized and other sources. But what is interesting to note here is that countries that have a very high denominator in the daily minimum wage, particularly these, have a very low number of days that are required for a worker to work in order to afford the drugs, whereas in these group of countries, workers would have to spend a lot longer period of time to afford that. An issue that is cropping up in this analysis is the utilization of this denominator, that inevitably it always is going to be the daily minimum wage is going to be a lot higher in European countries. This analysis would probably look very similar if you substituted all of these drugs over here, but put in generic drugs, for instance, and it's very likely that you would find this gradient as well. And the reason for this gradient over here is because of this very high denominator that's being utilized. The other point to raise is related to the relevance of utilizing a denominator which is based on daily minimum wage. And what I mean by that specifically is that many of these countries, the worker is not paying out of pocket for these medicines. So it's very unlikely that in a country such as Spain, for instance, or in fact most of these countries, that the patient would be going to an oncology center or a pharmacy or a hospital and paying out of pocket for the drug, which means that utilizing a measure that defines affordability based on number of days to work in order to afford it is not really getting to a true measure of affordability. This measure may be more relevant in the context of low-income countries where there aren't developed social and health institutions to be able to provide and purchase medicines available in the market and provide them to the patient. Perhaps introducing a level of copay may also be a degree of measure, maybe a degree of affordability, perhaps also looking at the proportion spent on these drugs over here vis-a-vis the total budget, whether it is disproportionate and potentially unaffordable for the healthcare system. But what we're dealing with here is centralized procurement agencies where there's stronger public health institutions and their ability to contain and regulate price. This may also be reflective of international benchmarking of medicine prices, reference pricing in these group of countries amongst each other, and possibly also the need to do a similar exercise here for these drugs within these specific group of countries. What this suggests is that a lot more work would need to be done in pricing policy in order to improve the competitiveness and efficiency of the market. There is no doubt that this level of variability between countries is an issue, but I'm not sure to what extent we're utilizing the correct measure of affordability between countries, especially in these group of drugs over here. Nonetheless, it is important work that's been done, and certainly something that we need to look out for in the future and see how it develops. Anyway, with that as a wrap, just a couple of points to ponder. You may wish to, and I highly recommend that you do download a copy of the paper. It is publicly available, and look into all of the details of the published study, how the data sources were sampled, specifications of the data analysis, and also the many more details related to the limitations of the study and discussion. So thanks so much for listening. Take care. Bye.